prizes for anyone who wants to move to the front row. I don't have prizes. You get prizes, the big prizes right there. Thank you. Come on up if you're in the back and you don't have a place to sit. Yay! Round of applause for the front row takers. Oh, we almost filled the whole row. That's so fun. Well, it's so fun to see all of you. What a gorgeous, gorgeous day. This weather is amazing. We were so ready for some relief from that heat. So welcome to this special event dedicated to the incredible work of KVC Health Systems. Today we're going to look back over the last year and hear moving stories of how your generous support has changed the lives of nearly 75,000 children and families. We're also going to look forward and learn what's coming next for children's mental health and well-being across our region and nationally. My name is Christa Dubill. It is an honor to be your host this afternoon. I first became friends with Jason Hooper and the entire KVC team when I was part of 41 Action News. I spent 20 years in television news and, as you can imagine, covered a tremendous amount of the stories that the people that work at KVC deal with on a daily basis, and I got to know Wayne obviously as well. A few years ago, I would say in 2017, I started really thinking, man, there's so much bad stuff going on in the world. I think I need 20 years is starting to weigh on me. I think I need a break, and I decided I was going to leave TV, and I wasn't sure what I was going to do, and I got a call out of the blue from Blue KC to say, would you want to come build our corporate communications team? So I transitioned into this brand new industry using what I'd learned as a reporter and anchor and all that I'd learned and all the stories I'd covered, transitioned to try to learn more about healthcare and continue to meet with Jason where we compare notes and try to figure out ways to continue to work together for the betterment of children in our community. A few years ago, I did make that move. It was 2020 in January, 2 months before COVID hit. Everyone can remember where they were at that time. It was right after a Chiefs Super Bowl parade, and then boom, we were all home for a couple of years. I share the passion you all have for keeping children safe, supporting their growth and development, and strengthening people's mental health, so it's really fun to continue being involved with KVC's mission and meaningful, and I think that there's a lot of impact being had. Today we gather to celebrate the power, compassion, and strength of family. We are here because we are working toward a world where every child grows up in a safe, loving, nurturing environment where they can reach their best potential. We live in a world where mental wellness is accessible to all. KVC is dedicated to making the vision a reality. And thanks to your support, KVC has been part of inspiring personal transformation that defy odds, literally. We strengthen families in crisis, protected vulnerable children, and change lives in ways that will have a positive impact on both these families and future generations to come. But none of this would be possible without your support. Your presence here is a testament to your commitment to the mission, and together we are creating a brighter future for countless families and individuals. And now let me take a moment to acknowledge some of the incredible individuals who make up the heart and soul of KVC. The dedicated staff, passionate volunteers, and the remarkable individuals who have overcome their own struggles and now serve as beacons of hope for others. Each one of them plays a crucial role in the journey towards stronger families, the prevention of child abuse and neglect, and the promotion of mental wellness. Let's give a round of applause to all the people, both with us in the room and joining us virtually, by the way, to fulfill KVC's mission every day. We've got many partners and heroes to recognize today, but before we get to the awards, we'd like to share with you some success stories that show how important KVC's work is in the community. If you have tissue in your bag or your pocket, I would get them out. Maybe you have allergies, but you can repurpose a couple of those tissues for what you're about to see. KVC is driven to be a world-class nonprofit that's influencing the fields of child welfare and mental health regionally and on a national stage. This organization is truly changing the face of foster care and innovating children's mental health. You know, mental health treatment covers a very wide spectrum of needs and services, and some of us access therapy in person with a therapist or even virtually through our devices. Medication from a doctor is also sometimes part of our treatment journey. Yet for many of the children KVC serves, a higher level of care and treatment is needed. The higher level is called residential treatment, and and involves intensive clinical services over a period of a few months. One of the places where KVC provides children's residential treatment is at KVC Niles, right here in the heart of Kansas City, near the historic 18th and Vine District. So we want to begin today with the story of Michael. Michael's a 17-year-old boy who had experienced a lot of trauma and adversity in his life, and is probably really understating what the young man had endured. Michael came to KVC Niles for residential treatment and got to benefit from some of the innovative expressive therapies KVC provides to youth. And one of those options that connected deeply with Michael's heart and his passion, which is what it's all about, connecting with them in the way that they need, was music therapy. Please take in this story of how the KVC treatment team helped Michael feel a sense of hope again and get what he calls a second chance at life.
My name is Hope Romero, and I am the music therapist here at KVC Niles, and I've been here for about almost 2 years.
I'm Ashton Johns. I'm the Expressive Program Manager at KVC Niles, and I'm a recreation therapist by trade. So a lot of our clients that come to KVC Niles have dealt with trauma in their past. A lot of that has been from their family life or their home, their community. And so all of our clients come and have dealt with trauma. And so when they get here, we are a trauma-informed care facility. And so everything that we do, all the therapy that we offer, all the interactions that we have with our kiddos are trauma-informed.
So we served this kid at Niles. His name is, we'll call him Michael. And I remember first meeting him on the first day of our spring semester, and finally he was like, "Hey, you're Miss Hope. I've been waiting to meet you for a while. I heard that you do music. I heard from this other kid on the dorm that you can record songs, and that's something that I've done for a long time. Even before I came here."
And so Michael, when Michael came to us, a lot of his past did deal with trauma, but it also dealt with a lack of identity that I felt like he had in himself. And so he was finding his identity in other places and with other people that led him into some situations that were not good. And that's how he kind of ended up at KVC Niles.
So within our sessions, it really started as just giving him just a space to express himself, just meeting him where he was at. And he's probably one of the only kids that I have seen every single week he was here. There was not a week I didn't miss a session with him. Even within the week, he would always say, "When are you seeing me next?" And I would always be like, "It's the same time, it's the same day." Or he would come up to me and say, "Miss Hope, I wrote another song. I wrote another 2 songs." So all he did really here at Niles was just write music, and that was just cool because he would do that outside of the space and outside of the facility. Right as he was graduating high school, also just timed well with him discharging and leaving, so he ended up writing that song called Niles, that he, once again, I didn't help him write a word of it. He was able to kind of premiere that song at his graduation party, so we played it for all the kids here on campus.
One of the things I really respect most about KVC is the desire to be client-centered. And so that's one of the ways that I feel that expressive therapy has really grown here at KVC Niles, is that KVC is willing to do whatever needs to be done to better our services and to create greater connections with the clients that we serve.
Let me tell you something real quick, hold on. It's funny how something bad can turn into something good. I can't change the past, but I would if I could. I was sick and tired of living in denial. Let me tell you about a place that helped me called Niles. Let's go! I was trapped up in the pain, didn't know how to use my brain. Thoughts of going insane, now I'm on a roll like a steam train. Look how many yards I've gained, never thought I'd feel this way. Looks like hard work, it pays, discharge, it's a new day. Never thought I'd get a second chance at life. I never thought I'd be the one to get it right. Get it right on sight, and I cannot lie. I'm kinda nervous now that I'm in alumni. Regardless of past tense, man, I wasn't alone. The staff here at Niles made me feel at home. Emotions so negative, thoughts can pick up the phone and leave a message at the beep, cause they'll hear the ringtone. Yeah. Life is gonna throw a brick or 2 at you just to see if you can handle the painful thoughts and the
felt so alone and he didn't have a path forward, and to know that that came to him through working with the two of you. If you would both come up, I think we need a moment to honor you. Hope and Ashton from KVC Niles. No, Jason, you were behind them. Get in it. I'm pretty sure there was a photo bomb just then. All right, we're all family here. All right, we have one more story here before the program moves on from these particular opening stories. But this one is from KVC's child welfare work. Every year, KVC cares for nearly 5,000 children in foster care. And that's across 5 states. And an even bigger part of the work is strengthening families in crisis and safely preventing the need for foster care in the first place. But sometimes children simply aren't safe at home, and the courts rely on KVC to help each child be matched with a permanent loving family through adoption. In these cases, the relative or foster parent who has been caring for those children is often asked if they would be willing to make the children a part of their family forever. Nothing is better than a child being told, "You are loved, you are a part of this family, you belong, and we will care for you for the rest of your lives." So please join me in viewing this video about a teacher from right here in Olathe who said she was willing to help if any kids in her school ever entered foster care. And once she opened her heart and her mind in that way, everything changed for a young brother and sister in need.
So my name's Michelle, and I have been in education for 25 years. I decided I would go ahead and do foster care, and started the classes that March. And then September came along, and I got my license. I was licensed for four kids. Halloween came, and 2017, and they called again as I was putting food in the oven. She said, "Hey, we have some kids. Would you like to hear about them?" I said, actually, my hands are kind of full. So I was wondering if we could put my home on hold. I forgot to tell you, if you ever get kids from Pawnee, let me know, because they're already enrolled in the school. They can actually go to school with me. She said, let me look before we hang up. And I said, okay. And she came back on. She said, "You're not going to believe this, but we just had 2 Pawnee kids come here, not even 2 hours ago." I said, I was just overcome with emotion. And I'm like, just bring them on over. Bring them over. I was moved to that school, to that specific job, to meet those kids. And so Halloween night, they showed up. It makes me emotional. Sorry. They showed up at the door. Just the weight of the world on their shoulders. They were just terrified. I'll never forget the look on their faces when they were like, "Wow, that's a teacher at our school." And they were just so excited. They came running in the house and they went everywhere.
It was crazy. Well, we lived in a really rundown apartment, cheapo apartment, really bad. And there were cockroaches everywhere. Whenever we would turn out the lights to go to sleep, which we never really slept. If you ever walked into the kitchen, the floor would just be covered in cockroaches. It was super creepy. I ate packing peanuts once. Yeah. So that was the only time I'd ever felt full. And I also ate ashes out of their ashtray. And those were the only times I really ever ate anything.
We would also get these food bags on Friday from harvesters. That's basically what kept us alive.
It feels better being here than it was there, because we realized hey, there are not supposed to be cameras in your house watching your every move.
There is supposed to be doors on bathrooms.
Yeah, there are supposed to be doors on bathrooms.
You are supposed to eat every single day 3 times.
And you're supposed to take a shower. We never knew what a shower was. I most likely learned, like, the most thing was, like, that parents are not supposed to be rude to you.
You're supposed to have loving parents, yeah.
Yeah, they're not supposed to, like, hurt you. I never knew that.
I had no reason to live. Now I do. I didn't want to live in constant torture or constant fear, anxiety. Now I don't have to go through that anymore. I feel loved.
There were lots of people at church that day, but I do remember looking back and seeing all of our KVC workers. And we had a few minutes to spare before the judge got on, and I did have them stand up because we would have never been where we were. We would have never been up on that stage without them coming out. And every single month when they would come out and they would leave, they would always say, "What do you need? What do you need? Do you need anything?" What I would tell other people who are possibly thinking of foster care or adoption, be ready for a journey. You know, it's just been a tremendous growth. I feel like I've grown a lot as a person just from going on their journey with them. Every child's gonna come with their own needs. You're all on this journey together. So, and that's what I always told the kids, you know, we're on this journey and we're together. And so, I'm not perfect, they're not perfect, but we're growing together. I don't know, it's been a beautiful journey.
Michelle and Michaela and Dakota, would you guys come up? Thank you for coming up. Thank you for being willing to tell your story, and we're so happy for you. We're happy that you're happy and feel loved and are loved. What a beautiful story that really tells the story of what you hope happens in almost every situation if it gets to this point, right, where there are children who need someone to love them. You've reminded us of what a precious gift family is in all of our lives, and in a very brave way have told your story. I can imagine it's pretty emotional. I'm seeing some cuddling over there. Do you need me to come cuddle with you? And we're all willing. And now it is my honor to introduce our next speaker. KVC has had only 2 CEOs in its 53-year history. First, Mr. Wayne Sims, very well known and respected, and did a lot of work in his time. And now Jason Hooper. Jason leads the incredible KVC team of 2,400 professionals. KVC now has over 60 locations in 5 states and is one of the nation's broadest continuums of care, with dozens of different programs and services that enrich and enhance the lives of children and families. Jason began with KVC over 28 years ago. I think you still tell your personal story. If you haven't heard it, please get him and have him tell it to you. It's very inspiring. He started in a direct care role serving children, and now he's leading KVC as it creates partnerships that are truly integrating and transforming healthcare. Please join me in welcoming Jason Hooper.
Christa. Christa's been a friend, not just to myself and Wayne, but our organization for many, many years. We've enjoyed not only watching you ascend from news anchor to executive with Blue KC, but actually participating in that path with you. Thank you for your support and friendship. Whoever had me following Christa, that was problem number one. but also, I mean, wow, the KVC Niles team and Michelle, Dakota, and Michaela, your why we're here, right? The team and the family, you epitomize everything about our why. So thank you for the inspiration, and thank you for allowing us to be a part of your journey. Thank you for sharing your story. I had to watch those videos twice last night to hopefully not tear up today. This event is special for us each year. This is an opportunity for us our organization to kind of hit the pause button, reflect back on the past year, celebrate the impact that we have been so fortunate to be a part of, and also kind of peek into the next year. And the folks in this room, the folks that are joining us virtually, whether you're a part of our team, whether you're a donor or a volunteer, you need to understand that everything that you're doing, the connections that you have with our organization, with our communities, you are changing lives. And that cannot be overstated. Your support is absolutely critical to our mission, and your support ultimately allows us and empowers us to do what we do, so thank you. We also have a few members here today with us, and we also have some virtually from our governing board as well as our regional boards. If you're in the room with us right now and you're on one of our boards, would you mind standing up briefly and being recognized? To kind of preempt the next video, I guess I do just want to say this. This past year has been a really, really special year for our organization. I think it's a year that won't easily be forgotten for many, many years. As Christa alluded to, at least in my 28 years, I know I haven't experienced a year where we had so much impact and also created so many new relationships that are going to drive future impact as this past year. Again, it's a year that it came with its challenges, but ultimately the rewards of that, the impact can't be stated succinctly. So sit back and enjoy this next video, and please understand everything that unfortunately you get to hear me talk about was created by you. It was created by everybody in this room, everybody that's joining us virtually, and all of the friends and supporters, all of our over 2,400 KVC teammates. You are the reason that this video is even occurring.
When people talk about KVC, especially people who've supported our mission for decades, they often talk about family. There's a KVC family that spans across many states and across time. And I think that's appropriate because KVC began as a group of families and close friends who wanted to help children. So we've always had a sense of being a community of caring. In fact, it was a group of caring women who founded KVC in 1970. Their hearts were moved by children who were victims of abuse and neglect, but had nowhere to go. That spark of compassion has grown into one of the nation's broadest continuums of care. KVC now offers everything from family strengthening programs to outpatient behavioral health care, foster care and adoption, and to the highest level of care, inpatient treatment at our children's mental health hospitals. And now, more than 50 years later, our family has grown again. Not once, but several times. So let me tell you about KVC's positive impact over the last year. I also want to invite you to check out our new 2023 Impact Report at kvc.org. First, let me tell you about Canberra Children's Mental Health, our subsidiary which is the leading regional provider of children's mental health services. Canberra is a network of nonprofit hospitals and residential treatment centers in Kansas City, Wichita, and Hayes. At our hospitals, we serve over 4,000 youth admissions each year, helping children who are in crisis due to severe depression, anxiety, self-harm, suicidal risk, traumatic experiences, and other mental health needs. These children desperately need not only treatment, but they're also searching for hope and the kind of authentic connection that is so foundational to all of our lives. At the beginning of 2023, we held a grand opening event as Canberra moved into a new location in Hays, Kansas. We completed a beautiful new $11 million building renovation so we could reestablish inpatient children's mental health services for families in western Kansas. This wouldn't have been possible without the support of Governor Laura Kelly and the Kansas Department for Aging and Disability Services, who partnered with us to bring about this new children's hospital. We're also so thankful to our 3 lead donors, the Patterson Family Foundation, the Schmidt Family Foundation, and the Dane G. Hansen Foundation. We held a ribbon-cutting ceremony with U.S. Senator Jerry Moran, KDAD's officials, our lead donors, and many, many other elected officials to celebrate this huge milestone. Even bigger news about Canberra came this summer. In June, we announced that KVC and Children's Mercy have formed a joint venture to open a 72-bed, best-in-class inpatient mental health hospital right across the street from our headquarters here in Olathe, Kansas. That construction is underway right now, and our target date for opening is late 2024. This joint venture is big news for Kansas City and represents a new model for transforming children's health through the power of partnership. The opportunity to combine KVC's nationally recognized inpatient mental health treatment with Children's Mercy's world-class pediatric care and research will elevate health outcomes for decades to come. Our country is facing a mental health crisis, and it's been inspiring to see so many partners step forward to help, including the Sunderland Foundation, Governor Laura Kelly, and the State of Kansas Spark Committee as lead supporters. Please check out this clip showing the leaders who helped us break ground.
There's hope. There's hope today, but today represents there's more hope coming.
This is a big day for the community, for the entire Kansas City region, the state of Kansas, and for the children and adults who have been suffering from the mental health crisis that exists.
Access to care, that's why we're here. That's the conversation. This project has been a long time coming.
Today is a great day for Olathe and a great day for Kansans.
I appreciate the opportunity to be here. I appreciate the opportunity to support the work you're doing. And thank you all so much for all the work that you're doing.
If that weren't exciting enough, KVC celebrated another significant event this year. To strengthen children's mental health, KVC and St. Louis-based nonprofit Great Circle decided to become one KVC Missouri team. This allows us to transform our collective services into a purposeful, connected system of care that serves as a safety net for children and families. Just 6 months ago, Great Circle's nearly 800 employees, along with all of its programs and services, became part of KVC. The KVC Missouri team now has more than 20 locations statewide, including St. Louis, Kansas City, Columbia, and Springfield. The team is serving nearly 9,000 people each year with family services, foster care, K-12 educational academies, residential children's mental health, and more. We're so honored to carry Great Circle's mission forward. We stand on the shoulders of pioneering children's charities like the St. Louis Orphans Asylum, established in 1832, and Kansas City's Niles Home for Children, founded in 1894 by Samuel Eason and later Frank and Emma Niles. Both are historic organizations that chose to integrate with us to form the foundation for today's KVC. There's also Boys and Girls Town of Missouri and Edgewood Children's Center. I want you to know about the men and women who started these charities, donated to them, and led them. They built incredible legacies of giving to help vulnerable children and families. And when these organizations chose to become part of KVC, they entrusted their legacy to us. And we intend to fulfill their dreams. We promise to do our part to advance well-being for all children and families so that every child we meet has a brighter future. I want to thank Lindsay Stevenson, president of KVC Missouri, for strengthening relationships with our friends statewide. In the last year, we've built positive working relationships with state leaders and legislators, new board members, donors, and volunteers, new families, and of course, our newest KVC employees. We hosted listening tours and welcome events celebrating this milestone. This is one of the single largest events in KVC history. And more importantly, it has unprecedented potential to transform children's mental health care. Children's mental health needs are on the rise, and KVC Missouri wants to be part of the solution. We're in the early stages of building philanthropic support to create a world-class children's mental health hospital in St. Louis and elevate treatment at all other locations statewide. And the news doesn't end there. We've also had highlights in our other states. Our Kentucky team is now more than 300 professionals strong and focused on safely preventing the need for foster care by strengthening families. If you want to help the most vulnerable children in Kentucky, including families impacted by the opioid epidemic or mental health needs, KVC is the nonprofit to support. In West Virginia, we received a grant from Aetna to expand into the Martinsburg area, not too far from Washington, D.C. This is allowing KVC to serve over 200 more families each year. We also recently announced a new partnership with Big Brothers Big Sisters in West Virginia to connect children in foster care with adult mentors. And in Nebraska, our team continues to grow beyond its core services of family strengthening and foster care to expand mental health care and services for individuals with intellectual and developmental disabilities. The final highlight I want to mention hits the closest to home. During all of this change, we focused on supporting the people who make it possible, KVC employees. These are incredible professionals who are social workers, therapists, and in dozens of other frontline care positions. Our focus on both the employee experience and the customer experience is translating into something very, very special. At a time when data shows that U.S. employee engagement is declining, engagement among KVC employees is soaring. We hit a new record in the percentage of engaged employees at KVC. We also achieved a 10-year record in employee retention, with many of our local teams at over 90% annual retention. This led to KVC ranking among the top 1% of employers in the nation with a high 77 work well-being score on Indeed. This matters because it translates into better experiences for the people we serve. We also hit a new high for our customer experience score based on surveys of clients and caregivers. I could share so much more, but I'll stop with this. Thank you. We simply couldn't do this work without you. Every gift and every hour of time you give helps us strengthen families, prevent child abuse and neglect, and help both children and adults achieve mental wellness. Thank you for supporting KVC, and we invite you to stay connected because we need your help to build a world in which every child is safe and connected to a strong family and a healthy community.
Of our program, which is where we mention and recognize a few of our amazing value-serving partners. The first value that we're going to focus on is simple. The heart of our work is helping people. The idea of truly seeing the people around us, helping them, showing kindness wherever we can, is central to everything we're about. And the partner that demonstrates this commitment to helping people so well is KMBC Channel 9. In January, KMBC 9 launched a year-long community outreach initiative called KMBC 9 Cares for Kids. They focus on raising funds for five nonprofits, including KVC, to provide sustainable solutions to the challenges facing kids in our region. The KMBC partnership has positively impacted hundreds of children and families in both Kansas and Missouri. KMBC 9 has been a driving force, helping to raise awareness and inspiring over $30,000 in donations to support children in foster care. Donations during our back-to-school supply drive in July broke a record for us. Thanks to KMBC 9's on-air coverage and in-person coffee for a cause events at the Roastery and the Black Dog Coffee House, we received donations from 300 new supporters in one single month. I want to thank KMBC 9 Caring for Children in such a creative, impactful way. As the KMBC 9 team makes their way up on stage, please check out this short clip to see how KMBC went above and beyond to make sure that children in foster care had everything they needed on their first day of school.
Coffee on us. KMBC 9's Jamie Weiss is live this morning at the Roastery off of West 27th for Coffee for a Cause. Hi, Jamie.
Hi, good morning, Donna. If you're not sure if you're in the right place, do not worry, because the factory even got the sign put up for us just so everyone knows today is our KMBC 9 Coffee for a Cause Day. So like you mentioned, we're going to be here all morning long encouraging people to donate to KVC Health Systems. When you walk in the door at the factory, the first thing you're greeted with is this QR code. And Brett, why don't we go ahead and zoom in case folks can't come meet us out here today. What I want you to know is we are trying to help foster kids around our community get ready to go back to school. A little donation of just $9 can help people get underwear, clothes just to get ready. $50 helps you get a new outfit for back to school. And so what is really special about today and being out here is from 9 to 10, you can come get a free cup of coffee on KMBC 9, but we are encouraging you to donate. That way we can help make a difference for foster kids around the Kansas City metro. Please join me in welcoming you.
Well, thank you very much for this recognition. I believe the name of this award is accurate for what we do at KMBC 9. We help people. We keep them safe. We keep them informed. We entertain them. But the team at KMBC 9 is also devoted to making this community better. And so in August this year, we kicked off our 70th anniversary. And knowing that the anniversary was upon us, last year around this time, we took a look at our community service effort. And I believe community service has been woven into our total commitment at the television station for all 70 years. But we decided to make a change, and we wanted to make it more focused. And what we came up with is an effort to help kids. And so out of that came KMBC 9 Cares for Kids. And it's a team effort. Everyone at the station is behind it, but I certainly wanted to highlight these two individuals. Joining me on the stage is our Creative Services Director, Jason Holloway, and our Director for our Community Partnerships, Kim Rue. And these two are really the drivers. So I accept this award on behalf of Jason, Kim, and our entire team. And most importantly, I wanted to thank all of you for what you do. We know this is not easy work. But we also know that you're out there improving lives, and we really, really appreciate that because you're doing a lot to better this community. So thank you very much.
Okay. Our second value is our character is built on authenticity and compassion. There's a lot wrapped up in that. It kind of starts with doing the right thing, and along the way, sprinkle in authenticity and compassion, but at the end of the day, also empower action. We've got two longtime partners, who both embody this value. The first is Cheryl Rathbun. Cheryl served as the Chief Clinical Officer for St. Francis Ministries for over 45 years until her recent retirement this past summer. St. Francis Ministries is an organization very similar to KVC, offering foster care services and mental health services to children in western Kansas. Cheryl and her husband Corey have been friends and valued colleagues of KVC for over 30 years, really trying to elevate outcomes for children and families across the state of Kansas. For 35 years, Cheryl has led the charge to strengthen Kansas families. Throughout her career, she has advocated for system-level change, from starting the first adolescent inpatient sexual abuse program to training other service providers on how to treat adolescent sexual abuse. Cheryl has also appeared on TV forums, participated in the development and implementation of treatment standards, influenced the development of Joint Commission standards for foster care, adoption, and case management, served on task forces related to managed care of the Child Welfare League of America, and authored multiple articles on the treatment of adolescent males. It's a lot. The most important thing, though, I'll say this. From the moment I met Cheryl, and I think if you talk to anybody in the room that has had time any time to spend with Cheryl. What she's really done is elevated the expectations and really the importance of authenticity, compassion, and really grit at the end of the day to get things done. Cheryl's not only a friend, she's not only an advocate, but she's somebody that we all look to at really setting the bar for what we want in ourselves when it comes to leadership and supporting children and families. I'm honored to share in this moment of recognition for Cheryl Rathbun. Cheryl, would you please come up and accept this award?
I don't have any notes. Interestingly enough, I almost missed doing this work because I went to my undergrad to be a math major. I had a great math teacher. I took trigonometry, calculus, everything you could take, and I went to pre-enrollment and accidentally ended up in the social work pre-enrollment. And I was too shy to tell them that that's not where I meant to be. And so they said, so are you gonna, get your major with social work? I said, well, can I take a lot of math? Well, yeah, if you want to. But I discovered quickly, this work we do is very much like math. It's all about problem solving and figuring out all the different pieces. And thank God I did, because it's how I ended up in Ellsworth, Kansas, met my amazing husband, who has been a huge part. In fact, Chad probably thinks he should be getting this and not me. A huge part of transforming Kansas, but we both worked for St. Francis many, many years. And it was, I knew Wayne, I knew Sharing Love, but I really got to know KVC when I met Jason in the PRTF pieces, and Linda Boss, and Bobby, and Aaron, and Danielle, and Lindsay. Those are the main folks. And here's what I need to share with all of you who are connected with KVC. They truly are who they say they are. I've had two brothers die in their 50s, and both times got flowers from KVC, and it always said, your KVC family. When I retired, beautiful flowers. I probably got them other times too, and I'm not thinking about it. But working with KVC was not about which organization we belong to. It was always about what is going to make children and families better in life. And so if I have a favorite family, it's definitely KVC. They're just amazing, and so thank you. Thank you.
I told you she's amazing.
Well, I don't know that this is mine.
I tell you, booking is by Crystal and Cheryl. Too good. We also want to recognize Walt Hill, who very much like Cheryl, recently retired after an incredible 45-year career. Walt has served as the executive director of High Plains Mental Health Center in Hays, Kansas, and in that role, really worked very, very closely with both KVC as well as our Canberra Children's Mental Health team to establish and maintain services for children and families in Western Kansas. Walt is a champion for mental health and for rural healthcare organizations. He's advocated for technology like televideo and greater access to care. Everyone from literally the governor to the statewide association of mental health centers have relied on Walt many, many times over, and we're all better because of him. Unfortunately, Walt could not join us today, but we're looking forward to delivering this award to him in person. So congratulations to Walt Hill. Please join me in recognizing him.
Hello, my name is Gina Kliachkin, and I have the great privilege of serving as the president of KVC Kentucky. Over the last few years, we've been growing, and now we are 300 strong, dedicated professionals focused on strengthening families and improving mental health and well-being. Our third KVC value is family connection drives our culture. And the partner that I think embodies this value is the Providence Montessori Middle School in Kentucky, in Lexington, Kentucky. Since 2014, every year they've been holding a bike-a-thon, where they gather pledges and they bike all day long. And then they take these wonderful donations, and come Christmas time, these families shop individually for our families. So I just can't think of a better example of families helping families in our community. The dedication over the fall throughout the Christmas season, all focused on this, and this is all it's so meaningful and so impactful, but the kids say it even better than I do. So I'm going to kick to this beautiful little video that put together their award acceptance.
It's been a really great partnership over the years. Your organization.
This has been a really great partnership over the years. Your organization's help with this event has made this event so much easier for us to put on, and so much fun as well for the students. And then our follow-up when we get to go and purchase the gifts for these kids, I think is a really wonderful full circle service effort that our school is able to do with you. So thank you.
Awesome. Thank you guys so much. Have a great night. Woo, everybody.
One of the things that Maria Montessori talked a lot about, and one of her precepts was, everybody does better when everybody does better. And we believe in community and service to other people. That's really the most important thing in the world.
President of KVC West Virginia. It is an honor to be here, an honor to be a part of this organization. Every year it makes me so proud to be a part of KVC health systems and be a part of KVC West Virginia. Collaboration fuels our improvement. At KVC, we're passionate about continuous improvement in child welfare through collaboration with partners who share our values, allowing for disrupting and charting new spaces. There's little doubt that the over 23,000 youth who age out of a reactive system each year often face insurmountable odds. We know many will not graduate high school and face navigating unemployment, substance use, unplanned pregnancies, and incarceration. We know education is vital to combat the unwanted outcomes and alter the trajectory and dysfunctional experience. We know that action and support is a stabilizing factor, and we know that partnership is crucial. A fantastic partner to KVC West Virginia has risen to the challenge over the past year. Dr. Dianna Phillips, Provost and Vice President of Academic Affairs for Fairmont State University, exhibits pragmatic curiosity, optimism, and professional competence to assume a leadership and partnership that promotes action and decisive solutions to address dysfunction. We know that a brighter future is attainable. Unfortunately, Dr. Phillips could not join us today because she's out of the country, but she thanks KVC for the partnership and the opportunity to join forces and alter the trajectory and chart new spaces for youth and care. Thank you, Dr. Phillips.
Hi, everybody. My name is Bobby Eckloff, and I'm the president of Camber Children's Mental Health. Can you hear me okay? I'm presenting the Partner Award for our shared value, urgency and innovation mark our approach. In February, with the help of generous donors and state partners, we were fortunate to be able to expand our services into Hays, Kansas, and the surrounding communities. We're going to be able to serve over 1,000 more children that reach each year. Think about that. Just give it a little clap for that. Over 1,000 more a year. When you're building a hospital for life-saving services, to prevent suicide, to help children in mental health crisis, urgency is required, innovation is required. We are grateful to KDADS, State of Kansas, and our 3 private funders who responded with urgency as we endeavored to open a new, innovative children's psychiatric hospital in Hays, Kansas, which you saw earlier, state-of-the-art. We're pleased today to recognize the Robert and Patricia Schmidt Foundation, the Patterson Family Foundation, and the Dane G. Hansen Foundation for their support. Joining us here today is Gary Shorman, president of the Robert and Patricia Schmidt Foundation. Gary has been a part of this project for the last couple of years, since day one, and has been on site multiple times. Please help give me a thank you to Gary as he comes up, and the Schmidt Foundation for their commitment to children.
It's so great to be here. And by the way, who all has a purple one of these on? I had to work to get this, and if you have purple, raise your hand if you're a purple person. Yeah, Bobby has those, by the way. They're great. Thank you for doing this, and more importantly, thanks for all you do to help kids and families. When you take a look at what we do, Bob and Pat Schmidt are wonderful people. I had a chance to work for them for over 30 years. They're wonderful people. They left a gift for us to be able to use in the communities we serve to help do things that make a difference. What KVC does, what Camber does, is make a difference. We saw what they did in just the building alone. I mean, Bobby and I were out there in hard hats walking around, all the dust, everything, tearing things out, and now they do have just a beautiful facility there. But it's not the building that makes the difference. It's the people in this room, the people that have done for years, had a chance to meet some of them, have been building this program for years with a culture of helping families and helping kids. And we're honored to be able to help do that as well. Thank you.
We are going to go ahead, even though we're going to go ahead and show video with the Patterson Family Foundation for their acceptance.
Hello, my name is Kevin Prine, and I am president. Hello, my name is Kevin Prine, and I am president and CEO of the Patterson Family Foundation in Kansas City. It's my honor to accept the Urgency and Innovation Mark Our Approach Award on behalf of our board and associates. Our foundation's goal is thriving rural communities, and sometimes we get an opportunity to support systems that serve the critical needs of multiple rural communities. When young people in western Kansas face severe crises, the new Camber Children's Mental Health Center in Hays will be there to provide help and hope. Thank you, KVC Health, for recognizing our foundation this way. Together with other funders, we are proud to play a small role so that you can provide care for Kansas' most vulnerable young citizens.
And we also have a video with the Dane G. Hansen Foundation accepting also.
Hi, I'm Doug Alvin. I'm very glad to accept this award on behalf of the Dane G. Hansen Foundation in Logan, Kansas. When KVC staff originally told us about this project, we needed a little bit of education about what was needed and why the existing facility was not adequate. After hearing the reasons, we knew this was a great thing for Hays, and this really will help tremendously to the parents and children that are involved and their families, because they don't have to travel 100 or 200 miles to a different facility, which really is a big strain. So thank you, KVC, for making this project a reality.
I'm Stevenson, president for KVC Missouri. Our next value is diverse perspectives are key to our progress. As Jason shared earlier, we've been thankful to grow our friendships with our Missouri partners over this past year. There are so many public and private organizations across the state that are working hard and are committed to helping to prevent child abuse and neglect and enhance child well-being. Across the state, the Children's Service Fund leaders take the time to learn more about the youth that we serve and their unique needs in each of our regions. We're proud to present partner awards today to 3 different Children's Service Funds who have provided resources for our children, for the children that we serve across Missouri. I have the St. Louis County Children's Service Fund, the Children's Service Fund of Jackson County, and Boone County Children's Service Fund. While children in St. Louis, Kansas City, and Central Missouri all have slightly different needs and environments, they all deserve to be safe and to be connected to strong families and healthy communities. I'd like to say thank you to Emily for coming in on her day off and bringing her lovely mother, and also to Seth for personally and professionally supporting KVC. And I'd like to welcome you guys up to accept your awards.
On behalf of the St. Louis County Children's Service Board and our really dedicated team, I want to thank you all for this recognition. I recognize we're in between food and fellowship, so we'll keep it short. We could not honestly achieve our mission without you all and the positive impact that you make in your community. So we want to thank you for all the support and services you provide, and we're really honored to receive this recognition. Thank you.
I accept this award on behalf of our board of directors and really enjoyed the partnership with Cheryl and Ashton and Hope. And thank you for letting us partner with you and serve the kids at Niles and really extend that tradition and enhance the work you're doing. Thank you so much for the support.
Video from Boone County Children's Service Fund.
Thank you. Thank you on behalf of the Boone County Children's Services Board for this amazing award from KVC. The board is so appreciative of the acknowledgement of the funding investment that they have made in the HOPE program. The board strives to invest in programs that are strategically investing in children and families in Boone County. Thank you again for this award.
Through here. We are on our last award of the evening. Each year we present the KVC Hero Award to an individual, couple, or organization who have made a tremendous difference in the KVC health system's evolution and in the lives of children and families. In the past, this award has gone to many wonderful individuals and leaders like Sesame Workshop, Kansas City Mayor Sly James, and business leader Bob Rainier. This year, we honor the youngest recipient of our Hero Award, a young man who recently turned 18 and began playing football at the University of Nebraska. Malachi Coleman, known to many as simply Kai, is a remarkable young man. Our KVC Nebraska team first met Kai and his sister when he was 9.5 years old and came in to need emergency foster care services. The KVC team matched him up with 2 wonderful, caring parents, Craig and Miranda Coleman. Little did they know that this young 9.5-year-old who loved to throw the football around would one day become the #1 college football recruit in Nebraska and one of the top prospects in the country with tens of thousands of social media followers. But even more special than his athletic talent is Malachi's heart. He has a heart for other children. 2 years ago, a little backstory, 2 years ago the NCAA that manages all of college sports began allowing student athletes to actually monetize their value on their name. NIL, name, image, and likeness. Well, Malachi got right to it. He immediately told his mother that he intended to get some NIL deals. Wonderfully, his mother said, Malachi, what do you want your name to mean? What a beautiful question. Well, he decided he wanted his name to mean hope. Hope for other kids like him experiencing foster care. Through his foundation, Fly Like Kai, he is donating the dollars he brings in from NIL deals to pay for activities like sports, dance, and art for kids in the foster care system. He's partnered with a Lincoln, Nebraska, one of his deals, he's partnered with a Lincoln, Nebraska restaurant to create a burrito with the proceeds going to help children. And he's also been featured nationally on CBS News and on the Kelly Clarkson Show. Please enjoy this video with a little bit more backstory on that.
I'm Ashley Brown, President for KVC Nebraska. KVC's Hero Award recipient is Malachi Coleman. We are so happy to have been a part of Malachi and his family's journey.
I'm Malachi Coleman. I'm from Lincoln, Nebraska. I'm currently a freshman at the University of Nebraska and I play football. So my dad wasn't really in the picture. He passed away when I was young, and my mom, she was a drug addict and alcoholic, so she didn't really take care of us either. I was homeless, and I was having to take care of my little sister from a young age, and it would mostly depend on me trying to get food wherever we can, whether it's from garbage cans, from begging people. And eventually my mom, she picked us up in a random car. She took us to a stranger's house, said she'd be back, and that was the last time I ever saw her. We got put into the foster care system at that point. So we ended up coming here and being with the family I'm with now. And I wasn't expecting to stay, I ain't gonna lie, because I've been passed around a lot at that point. I thought I was just gonna be there for about a year and then get moved on again. But this family, they stuck it out with me. They saw how much struggle I'd gone through at that point to get to where I'm at. And they knew that was gonna be hard. Well, they definitely knew it was gonna be hard, but they still love me enough to say that, I want you to be a part of my family. And just having people that are like that in my life, I hadn't had up to that point, so it's very special for me.
I'm Miranda Coleman, and I am Malachi's mom.
And I'm Craig Coleman. I am Malachi's dad.
So Malachi and Nevaeh were 6 and 9 when they came and started doing home visits with us. And, you know, it really felt like we couldn't be another set of parents to let them down. We didn't want to just be another stop on their journey, that somebody needed to step up. The state did tell us that if we didn't adopt them, that they were going to separate them, and we could not let that happen.
I kind of did my own thing. I didn't talk to them. I never even let them touch me. I never hugged them, nothing. And eventually, over time, we started working more and more and more, and they got me just to open up more and to show that I do have value. To save me like that is something that I'll never have again. And I praise the Lord for that, because without them, I wouldn't be here today. I think I started football like 5th or 6th grade. I was always a little bit naturally gifted. My senior year, I kind of just started to narrow it down from my own offers to where I wanted to go. And there's a lot of stuff that happened with the coaching staffs and a lot of changes, but at the end of the day, I knew that Nebraska was the place that I wanted to be. So I stayed home, committed there, and I've been playing as a freshman.
When Malachi moved in with us at the age of 9, he only talked about football. As the #1 prospect out of the state of Nebraska, he's had a lot of doors open for him and is in the top 100 recruits in the nation. So of the 40-some offers that Malachi got to play D1, he did choose to play at home at Nebraska. As a lifelong Husker, it's been a big blessing for us to have him close and get to participate in all the things that a student athlete gets to participate in.
Seeing the dreams that Malachi had when he first came to us come true is just amazing, and I'm really excited to see that he has that opportunity to play at the next level.
I asked him what he wanted his name to stand for, and he's like, I think I want to give back to kids in care. But that's really the heart of Malachi, is he gives to others before he gives to himself. So Fly Like Kai is to pay activities fees for kids in care so that they can pursue their passions.
I kind of wanted to be different. I didn't want to keep the money for myself. I wanted to make an impact off of it. So I talked with Nick at Muchachos, and because he'd been doing deals with other Nebraska athletes at that point, and I wanted to see if he'd be interested in doing his first high schooler. And I had a sit-down conversation with him, told him my story, told him what I wanted to do, and we came up with a burrito, or called a Give Burrito at Muchachos, and the proceeds for that go to the foster care system.
What makes Malachi so special to me is just who he is at his core. To see how far he's come since his journey really began to who he is now. He's just an amazing, amazing soul, and it is who he is. But to see, the support he gets from his family, his sister and his parents it's inspiring to me.
KVC just stayed with it and helped me find the right home. They didn't give up on me. They didn't just send me to a group home. They tried to match me over and over again, give me opportunities to find something that I really did want. And getting me with the Colemans and family I'm with now, it's all because of them.
That is an incredible young man. As you can imagine, Malachi, with his fall football schedule, could not join us. The Colemans are joining us virtually, and so I know you've already recognized them, but let's send some real love back to Nebraska. Let them really have it. To express their gratitude for this award, but we need to finish off with this. Malachi, our gratitude is to you. His example of such great selflessness, putting the priorities of other people first, that's what we all aspire to do. And he's just I hope someday I get to meet him in person, because you can tell he's an absolutely special human being. So again, congratulations, Malachi, and Craig and Miranda. Thank you so much for sharing your story and sharing your love with the world.
I found myself going, where's the camera? Where are they? Are they watching right here? Here. Hi, everybody at home. Hi, Malachi. Well, what a moving hour we have. What I always appreciate about this group is they're very cognizant of time. A lot of busy people in this room, I'm confident of that. Thanking everyone here for the stories we've heard and for all that you've done. And your mom, it's all family. For everyone here who works every day to serve these kids and to serve the individuals you serve and the families who Michelle represents with her family, very inspiring. So thank you to all of you in this room. As we close, let us remember that every contribution of time, resources, or advocacy, no matter the size, makes a difference. Your generosity allows us to touch more lives and make a lasting impact on our community. So I encourage you to consider how you can be a part of this journey, whether it's through a financial donation, you knew that was coming, volunteering your time and skills, or simply spreading the word about KVC's mission. Every single effort counts. And I know this organization means that. As we go from here, let's stand together, united in our commitment to creating a world where families thrive, where children are safe, and where mental wellness is available to every child, young person, and adult. Thank you for supporting hope and compassion and making possible KVC's incredible journey ahead. Please stay connected with KVC on social media and in person. Have a wonderful evening.